Julian Henley, thank you so much again for your time and talking to us now about the neck. I know a lot of ladies, as they age, is it fat or what goes on with your neck as you grow older?
Well, as we grow older, and I'm the example of this, we get a looseness of the skin and the underlying musculature. And we begin to lose this mandibular angle that's desirable. And people who may have a receding chin lose it a little faster. So part of the sign of aging is this loss of definition in the neck, and some of our ladies and some of our men patients really dislike seeing this loss of the angle and tissues moving downwards. These are best correctable with surgical approaches. We do a neck lift that sometimes is often a part of a facelift. What it does is reposition and tightens those tissues. Over the last 10 years or so, in order to get a longer lasting effect in the neck, I do a double layer or something called a waddle neck suspension, where I have internal structures that tighten the muscles underneath. And I published that about 10 years ago, and it has served me and my patients very well. It's a technique that lasts a lot longer than just pulling the skin, because the older procedure, just tightening the skin, after a few years loosens up and you get the laxity in the skin. What I've been doing over the past 10 years is both tightening the skin and tightening the muscles and the deeper layers of the fascia, and run a suspension type of technology internally that gives us a long-lasting, improved definition in the neck.
And the suspension, is that a separate material, or is that just using muscles and repositioning where the muscles are?
It is a material used. It is recently I've been using the BioMatrix material because it's both elastic and it gives us a long-term suspension, and then after a while it's replaced by your own tissue. I have also used a number of suture material that is used in cardiac surgery to hold the valves in place. So it's a fairly sturdy reconstruction.
So you're a total science guy, aren't you? Like, you'll look at what people are doing with heart and different operations, different types of procedures, and wonder and think about how that can serve your patients in the aesthetic space.
Well, that's really my thing, is the use of science to benefit patients. As a matter of fact, I'm much more at ease with the technology than I am with the camera you got pointed at.
Oh, you fool me. You're quite charismatic. You definitely have a way of putting people at ease. Do you find that, when people come, they could be very nervous about, doing these types of surgeries and things? And, what do you recommend as far as a patient, to collect themselves?
I think it's natural to be nervous. People get apprehensive. And we just have to work around this, because ultimately what counts is the result you're going to get. I still remember a patient of mine who came in to have their nose. They've always hated their nose, and they really wanted it. But doctor, I'm so nervous. I don't know if I can do it. I says, look, I can straighten out your nose, but I can't straighten out your nerves. So we're going through this discussion. He says, oh, I really want it. Let's do it on a Monday morning. We've made arrangements. He says, oh, but doctor, I'm not sure if I can go through with it. I says, look, let's make a deal. Let's set it up for that day. If you show up, we'll do it. If not, I'm going to have a civilized breakfast and coffee, and you'll go about your business. Well, I'm there at 7 o'clock in the morning. Patient is not there. So I'm ready to go have coffee and have a civilized breakfast. We get a call. The patient is in the parking lot. He's calling. He says, can you send anesthesia to put me asleep in the car and bring me in? I says, no. If you want this, you got to come in at your own free will. And he did. He went through it. So there are stories where people's nerves affect their ability to get something done, but those that can do it end up quite happy with the end result.
And what about, I know with noses, that's absolutely a specialty of yours, given, you know, your area of study. What happens as far as people who are coming to you for revision rhinoplasty? There's been a lot written that it's always the worst thing. Like, once you have one done, you can never get it repaired, or what do you think about that?
I think revisions are more challenging because you're dealing with scar tissue and you're dealing with a patient who's already had an experience that was not optimal, and you know, you would prefer that you do it once and not have revisions. But even in the best of hands, occasionally there can be scar tissue formation, so it's not a guarantee that there can be no revision. But I think the problem comes up is when you have doctors who run a 40% revision rate.
Interesting. Okay.
Versus doctors that may run a 2% revision rate. So everything is really, can you get the result, consistently good result, with minimal problems? There is no such thing as surgery that guarantees no problems and no possibilities of scar tissue formation. But at the same time, if half of your patients have a problem, then maybe you shouldn't be doing that operation.
Interesting. Very interesting.
So from the medical perspective, we look at the revision rate and what percentage of patients need some further refinement.
So now for people who are investigating, doing their research, going on the internet, finding doctors that they might want to audition, if you will, for the procedure, whatever one they want, what are some tips that you give to, you know, to people who are doing that research? What should they look for in a doctor?
Whether the doctor has sufficient experience with that particular operation, the doctor should be able to show you a reasonable amount of examples of him performing this operation on other patients. If it's showing you only one or two cases, well, anybody can have one or two good results. And then when you see the kind of work that doctor does in the area of your interest, if you're looking for nose jobs, then see some examples of nose jobs. Look carefully. Does the nose look natural? Or does it look like it was operated? The key part of good result is that the patient looks good, but the nose does not look like it was done. So the tips are, look at that the doctor is experienced in the area that you're looking at, that he is qualified to do, that he has hospital privileges, that it's not being done in a garage or some office. You know, a real operation is performed in hospitals, and hospitals are obliged to retain on their staff certain level of quality. So board certification is helpful. Hospital privileges is helpful. But ultimately, take a look at the results he's getting on other people, he or she. If you like the results and you think the results are aesthetically pleasing to you, then that's the right choice for you. If you're seeing the kind of noses that don't fit the face, and they're obviously operated noses, then maybe that's not for you. So part of your audition is this a real result?
All right, well, we have now news on necks and noses with the expert, Dr. Julian Henley. Thank you again. And we'll be back with some more questions, more on the background of you and your studies and what brought you to where you are today. Thank you so much.
My pleasure.